Hello everyone, welcome to the last episode of Movember November, putting Dr. G on the spot. Lastly, but not the least, we're going to talk about testicular cancer. When we talk about testicular cancer, the name that constantly pop up will be Lance Armstrong. Because in 1996, at a very young age, Lance Armstrong had the diagnosis of testicular cancer. The cancer itself is well known to have spread to his brain, and subsequently he was cured from the condition. Well, cured technically, because when the brain is involved, it usually is a late stage cancer, but can he really be cured? Testicular cancer is one of the most curable cancer. Therefore, we want young men to do regular checkups. So, testicular cancer itself usually is asymptomatic, and men who suddenly feel a painless lump in the testicle, usually hard in consistency, we really need to worry about it. There are not many people who are at risk of it. Usually, the people who are at risk of it perhaps will have undescended testicle during childhood, and that's the only risk factor that is well known. However, for vast majority of the sufferers, they don't have any side effects or they don't have any symptoms at all. When it's discovered, usually, hopefully, it's in stage 1. Because stage 1 cancer, the patient needs to undergo something called radical orchidectomy. We remove the testicle through the groin area rather than the scrotum because we don't want it to spread anywhere else. But prior to the removal, several things need to be done. First of all, we do an ultrasound scan. Apart from that, something called the tumor marker. The blood test of the tumor marker can determine whether it's elevated or not. But even if it's not elevated, it doesn't mean that there's no cancer. But in addition to all that, since the cancer itself affects young individuals, we would like to store and freeze some sperms so that the sperms can be used for future. Just in case the testicular cancer has been eliminated, then the treatment itself will render this person infertile. The interesting fact is, even though Lance Armstrong's cancer spread to the brain, it really didn't do him too much damage. Lance Armstrong's cancer was removed initially through radical orchidectomy, and he had 2 cancers in his brain that was removed. Following platinum-based chemotherapy, 20 years down the line, he has done so well as far as his sporting career is concerned. He has won Tour de France several times and also has fathered several children with different partners. Therefore, the actual moral of the story is testicular cancer can affect young individuals, especially young productive men. There are 2 types. One is called seminoma that happens in 25 to 40 years old, and the other one is called nonseminomatous germ cell tumor. The one Lance Armstrong has is nonseminomatous germ cell tumor, and the subtype that he has is actually a so-called the choriocarcinoma. An interesting fact is that all these cancers, whether it's seminoma or non-seminomatous germ cell tumors, all of them are very amenable to chemotherapy, and therefore 20 years down the line, the cancer can be potentially cured. As we venture into the month of December, we are venturing into months of festivity and indulgence. We're going to talk about certain things that we will really not want to indulge too much on. Therefore, I'm going to focus on pleasurable things that you probably worry about. Too much of that might be a bit of a bad thing. The first thing that we're going to talk about will be pornography. If you're somebody who's addicted to porn and a little bit worried about your consumption of porn might be a bit too much, then you need to stay tuned on next week's Putting Dr. G on the Spot.